Right now, we're joined by Mark Murphy from Providence Business News with a couple of really good headlines from the last week. Let's begin with healthcare, right? This is something a lot of people care about. We're seeing more big conglomerates start working together, especially with Hasbro and Children's, right, in Boston. Tell us a little bit about that in your coverage.
Well, it's sort of a continuum of care, right? And so for a number of years, Children's Hospital in Boston has been taking on very complex cases from Hasbro Children's. And that's not unusual, we've found. I mean, for instance, the Care New England system, and specifically Kent Hospital, has had a cardiac care affiliation with Brigham and Women's Hospital in Boston. So that's sort of the, they're formal, but they're not, a takeover, which is, of course, in the news. The Brigham and Women's is part of Partners Healthcare planning to buy Care New England. But it's also sort of more informal stuff. So Rhode Island Hospital is literally right next to Women and Infants Hospital. So if there are some really complex and emergency situations, they're not going to go up to Boston Children's. They're going to go right across the street to Rhode Island Hospital. So it helps deliver, it helps fill in gaps for how much care can be delivered locally in a sense.
Is this good for hospital business, would you say, when it comes to the bottom line as well? And are the costs carried over to the patient or the savings?
Well, I don't know that it depends to a certain degree on what kind of insurance you have and what kind of agreements are reached. I mean, there are accountable care organizations, which are otherwise known as risk-sharing organizations, and those the cost can come down. I don't think if you were to ask any of the hospitals involved and the doctors involved, it's not for them about the money. Now, at the end of the day, the people who are counting the money are going to sort of pay attention to that. But I think they'd all say that it's about care for the patients.
Some folks are worried, though, that too many hospitals coming together on the business end isn't necessarily good for the patient, depending on how big. Partners is big. Lifespan is big. At what point, though, is going local about going smaller, too, also advantageous?
Well, I think if you talk, for instance, to Timothy Babineau, who's the CEO of Lifespan, he would say, look, what we're trying to get is a full continuum of services to the people in Rhode Island. He said Massachusetts has 4 full services, Rhode Island has none. He says we have about 85% of it. We'd like to have 100% because then all of the healthcare decisions would be made in Rhode Island for Rhode Islanders, and so they argue that it's actually a better thing. These kinds of combinations are happening all over the country. So I don't know whether Rhode Island is on the is on the cutting edge by holding back, or whether they're sort of falling behind. It's difficult to see that getting a more complete system is a bad thing. The question is whether or not the financial aspects take over and subsume the patient care.
We'll have to see, right?
That's right.
All right, thank you. And PBN is out. Great, thanks, Mark.
Thank you, Allison.